So we have been discussing about the health and immunization sector. We started our discussion with the immunization program wherein WHO has ranked Southeast Asia region as the number 1 in vaccine of DPT3. Excuse me. So, within Southeast Asia region, India and Indonesia were the responsible countries who have made the entire region come to the top notch. Okay, after that we studied about the immunization programs going on in India, that's Mission Indradhanush and its intensified program. Okay, after that we were discussing about the challenges of health sector, accessibility, affordability, availability and all that. Okay, so to continue in that discussion, we are also going through certain data. The first data that might be required for our mains exam is this. Almost 2.1% health sector is witnessing only 2.1% of the GDP. So that means whatever we are generating in terms of economy, in terms of goods and services, whatever money the government is able to generate, only 2% it is spending in health sector. Almost 2.1%. This is the expenditure in case of health sector as a percentage of GDP. Okay. Amongst this, one major program that the current government has come up with is that of Ayushman Bharat. Before that, this was less than 2%, somewhere around 1.5, 1.8%. Okay, Ayushman Bharat has led to a significant increase in the GDP expenditure as a percentage of GDP in the health sector. So, what is the scheme about? There are two basic tenets of the scheme. One is the Health and Wellness Center, and the other one is PM Jan Arogya. Under Health and Wellness Center, we are creating sub-centers, right? If you remember, we had PHCs, primary health centers, and district health centers. So, like that, we are creating health sub-centers, and the criteria is, and the number that we need to remember here is 1.5 lakh. 1.5 lakh health and wellness centers have been created under Ayushman Bharat scheme. Okay. The other tenet, that is Jan Arogya, this is talking about the health insurance. Okay, under this health insurance, 5 lakh rupee per family per year. That means in India, on an average, we assume that a family is consisting of 5 members. So per head, it becomes on an average 1 lakh per person. The government is spending it like this, that it is giving a health insurance coverage of 5 lakh per family per year in secondary and tertiary care. Okay, so if you are coming for secondary and tertiary care, you will be actually provided with a Ayushman Bharat card. Okay, you can go for cashless transactions. You can give this card; they will deduct money from the insurance account itself, and you don't have to pay anything to the hospital authority. Okay, so that is the idea of Jan Arogya. So there are two basic tenets. One is Health and Wellness Center. The other one is Jan Arogya under Ayushman Bharat. Okay. Under the scheme, government has also said this, that there will be no cap on the family size or age. So if the family size is less than 5, okay, let's say if the family size is only 3, still they will be getting 5 lakh per family, or even the age, the lowest in the family and the eldest in the family, everybody will be included. Okay. So there will be cashless benefits, as we discussed. There will be cashless benefits which will be portable across the country. Okay, you can go to any government hospital and get this, get your secondary and tertiary care done under the Jan Arogya scheme. Okay, under the Ayushman Bharat scheme, it will be totally funded by government, so you do not have to pay anything for this. And National Health Authority, this will be the nodal agency. National Health Authority will be the nodal agency for implementation of the Ayushman Bharat scheme. Okay. Now discussing about the progress of the scheme. This is important because if in case Ayushman Bharat comes in exam, that it has been launched for over 3 to 4 years. So what is the progress of the scheme? In terms of progress, this is a significant number. 49% of the Ayushman card recipients are actually women. That means for women, we have been able to successfully deliver healthcare services because they are holding Ayushman card. That means they can go for cashless transaction of money in terms of healthcare services. They can get the healthcare services, present the Ayushman Bharat card and get the services done. Okay. Additionally, 48% of the authorized hospitals, there are certain authorized hospitals wherein you can make use of the Ayushman Bharat card. That is again a very good number. Okay. Additionally, government is also planning to extend the services. For example, prevention and control of NCDs, that is non-communicable diseases, ophthalmic, that's eye care, ENT, and there will be other services depending upon what kind of services are greater in demand. All these services will be included under the Ayushman Bharat scheme. Okay, and government is also planning to make use of artificial intelligence to prevent fraud in Ayushman Bharat. Matlab, you cannot get fake Ayushman Bharat cards. Okay, for this government is planning to inculcate or introduce the AI to check whether the fake IDs are not being used. Okay. Now coming to another topic that is again running in news, which is related to digital healthcare. Even if the topic directly does not come in your mains exam, you can use it as a pointer in some of the other exam, some of the other papers, GS 1, 2, 3, 4, or even essay. Okay. So what do you mean by digital healthcare? It actually refers to integration of medical services to IT. That's it. For example, telemedicine, robot-assisted surgery, electronic healthcare records, and report analysis. So, if you are able to get the medical services at your home with the use of IT, okay, the doctor is not physically present in front of you, or you did not go to the doctor physically, okay, in that case, we will be calling it as a digital healthcare. Okay, what is the advantage? The biggest advantage is we can provide healthcare services at remote locations. You remember we have been reading this as a problem that even if hospitals are there, PNCs are there in remote locations, doctors do not have any motivation to work there, right? So telemedicine can be a solution that the doctor is sitting at home, you show him the reports, okay, online you submit him the reports, or you physically, on call you talk to him, you tell him what are the problems faced by you, and he will give you, he will do the diagnostics accordingly. If in worst case it requires, you may visit the doctor. Okay. So healthcare facilities can be made available in geographically inaccessible locations. This is the biggest advantage of digital healthcare. Other than that, it overcomes the time-related aggravation of disease. For example, if we are suffering from certain disease, we need to visit to the doctor. Because of time delays, because of inaccessibility, the disease can get aggravated. Such things can also be catered to if we are going for digital healthcare. It also reduces the cost burden of transportation because you don't need to physically go to the doctor, and more patients can be treated in the same time. But look, we can tackle the disease faster in an area if we go for this. Okay. Apart from this, during COVID, we have seen a significant increase in digital healthcare. Okay, because there should be a minimum contact between doctor and the patient. So we could have made use of telemedicines, or we even have used telemedicines in case of COVID-19. They have called the doctor on call and told him such and such with the symptoms. Doctor has prescribed them medicine. They have gone to the medical shop and got the medicine back. Okay, so it is as simple as that, and it has reduced the spread of particular disease also. Okay, so that are some of the advantages associated to digital healthcare. But it has certain challenges also. The challenges are, in case of India, our digital infrastructure is very poor. Okay, we have not been able to provide internet services in every village. So the problem of remote location is still not solved. Secondly, lack of technical know-how. We do not know. At least in rural areas, people have avoided using smartphones, right? So they do not know how to make use of telemedicine. So the lack of technical know-how because of, let's say, poor education and illiteracy, but it is there. Additionally, fragmented healthcare facilities hitting on economies of scale. So usually, how do we have healthcare facilities? A small clinic, some 2-bed hospital, 5-bed hospital. Like this, we have some n number of hospitals in an area. Okay, if they were united, okay, and they could have installed, let's say, telemedicine technicalities. Okay, whatever machines are required, they could have installed by getting united, and the doctor could be available anytime. Because they are distributed and it is rather fragmented, so they are hitting on economies of scale. Okay, so we are not able to generate profit. Okay, everybody will have to install those machines. And maintenance of privacy related to patient might turn out to be difficult. it will be difficult because let's say if a patient, for example, I am not very much educated, I know what are my symptoms, I will get I consulted the doctor on telemedicine. They told me कि you do such and such test. Okay, I went to the lab, I got the test done, I have the reports with me. Again, I will do this that in terms of telemedicine, I give a call, I'll ask somebody, you read out these things. Such and such are my reports. You please read it out to the doctor so that the doctor can prescribe the medicines. So the privacy of the patient is lost, right? So maintenance of privacy related to patient might turn out to be difficult. Okay. So what are the government efforts? If we are able to tackle these two majorly, these three majorly, that's education and digital infrastructure, we will be able to cater to the major problems of digital healthcare facilities. Okay. So what are the government efforts? First one is National Digital Health Mission. It has been initiated for a unified digital health infrastructure. So there will be one net, okay, one cable line across which everybody, all the doctors will be connected. You can choose the doctor, talk to the doctor, get the medicines prescribed. That is how this National Digital Health Mission will work. It has not been implemented till now. Also, telemedicine practice guidelines have been introduced. This is for regulation and diversification of teleconsultation services. So, how will these services be working? All that is described and regulated under telemedicine practice guidelines. Okay. So, with that, we come to the end of this topic. We'll continue it in the next video. Thank you so much and all the very best.